you're confused right now. You're confused or you're torn between going for chiro or going for massage or maybe do physio first or maybe do osteopathy or maybe do this or maybe do that. You're confused right now. Which treatment should I go first and which treatment should I prioritize? Should I just focus in massage? Should I combine it with something? Yes or no? True or false? Which one is which? And you're in luck today, again, because we are going to talk about the importance of understanding the unique benefits and approaches of each therapy to make informed choices for your health and wellness. For this episode, we are going to compare massage therapy to other alternative treatments to see which one is the best for your condition. So if you're ready, then I'm ready. But are you sure that you're ready? Because if you're not ready, be ready, because I'm ready. So annoying. But let's go. Hello everyone, my name is Stephanie Palisok. I'm a registered massage therapist here in Toronto, Ontario, and I'm also a massage therapy instructor in a private school in Brampton, Ontario. They're very close with each other. It's not that far. 30-minute drive away, if you don't know where that is. But for today's episode, I'm gonna put my patient hat and my RMT hat separately. I'm not going to talk only as a massage therapist, but also a patient. So I'm going to share my experiences as a massage therapy patient, a chiropractic patient, a physiotherapy patient, and an osteopathy patient. Okay? More of that than being an RMT. Because I want to see if you can relate to how I'm experiencing these treatments, and at the end, we're gonna try to circle back and use the RMT hat to connect all the decisions. Does that sound good? Because I think it is. Okay, so in my previous episode, which is understanding the benefits of massage therapy, we discussed that massage therapy is beyond relaxation. It's beyond that. So meaning to say, it's not just relaxation and removing general tension, and stress, but also to treat condition. So as a patient, I usually go for massages because I believe that the problem is muscular. Like it's in my muscle. I believe that the problem is in my muscle itself, and my muscle needs to be manually manipulated using soft tissue or, as you know, massage, so that it would open up if it's too tight and it would strengthen if it's too weak. But through manipulation, like actual massage. And if I'm a patient, I would probably expect that the visits are the longer the visit, it might be beneficial to work on multiple areas, but the frequent the visit will be, more work will be done in one area. But again, that's just me. So long story short, if I am going for massage therapy, the effects that I'm going to be expecting is something in a longer form of treatment, like an hour massage, focusing on the areas that I need to be stretched through massage. So using massage techniques that can help stretching and strengthening areas that needs work will help me both physically and mentally, because I'm not going to overthink what the pain is, right? So it's like a both. I'm going to win in both physical aspect and mental aspect. I cannot explain further for the massage therapy part as a patient, because I don't want to be biased. But if you want to know the benefits, risks, and advantages and disadvantages of massage therapy, then you can visit my first episode of Thrive RMT Podcast, and you're gonna see what I mean by why choose massage therapy, right? But yeah, let's circle back into that and let's go to chiropractic care. So let me tell you a story. Okay, it was Christmas, and as you know, Christmas season is the busiest time for massage therapists because most patients are trying to finish off their insurance coverages. Am I right? Yes, I'm right. This is where we make good money. Because I'm very hardworking, I chose to overwork myself to take advantage of the busy season. We have gifts to buy. Don't judge me. But anyway, and then suddenly I felt a dull, achy pain on my head. So if you can see the video podcast, it's coming from my upper back, behind my ear, going to my head. So it's like wrapping both sides, and it feels so heavy to the point that I kind of just want to pull my head off. Like I need someone to pull it, but I'm still so busy with treating patients because again, it's Christmas season, it's very busy. And then good thing I did have a coworker. He's a chiropractor, and he's like, I've seen that you're working too hard. Are you okay if I give you some neck adjustments? Right? Who am I not to accept it? I said, sure, let's do it. And he used the massage gun, tried to release everything around my neck area, upper back, mid back, everything. And then, I don't know if that's the right sound, but it sounded like that, like firecrackers, and my headache, gone. And that's because my neck joint doesn't have a lot of pressure anymore because of the adjustment. Sounds right, correct? However, after that, I didn't feel so well, and I feel that my headache is more than when it started. So I called my other chiropractor friend and asked, the adjustment went right? Why am I feeling more headaches now than earlier? And then she explained that it's probably because the muscle wasn't ready enough and the adjustment helped, but the muscles around it wasn't ready enough and you had the side effects. Again, it's not all perfect. However, she gave me some self-care things to do, and after some time the headache went away because now it was focused on the muscle. And then there I understood that it's massage therapy and chiropractic treatment is a good combination together. Why? Because if your muscles are prepared, then you do the adjustment, then you would have more relief because you're targeting two things. First, you relax the muscle, then you do the adjustment, and then from there, we'll see. I think it's a nice thing that happened to me. Like, it's very awful, the feeling, but after I understood why I had to experience that pain after, I appreciated chiropractic care more because it means that I cannot just go to the chiro without preparing my other muscles, and it makes sense. Again, like what I mentioned in my previous episode, your joint will not move with no muscles and nerves, of course, but it goes hand in hand. So I think if you need to focus mostly on the joint and in the spine itself, especially that the spine technically is like the foundation of the whole body because it holds literally a connection to your upper limbs and lower limbs, then of course if you adjust the the spine, it does make sense to me, right? To open that up so that other areas in the body would also relieve the pressure, but at the same time adding, muscle care or maybe a little bit of soft tissue work before the adjustment can also help. That's why when I go to a chiro visit for my neck, the chiropractor I see right now, she really, do the muscle work first, try to really open everything up and then do the adjustment. Now, going back to my story, this chiropractor wasn't a bad chiropractor for me. That was one of the best adjustments I've ever had. I just think it does make sense that I had that side effect because my muscles weren't ready. And again, that was a free treatment. And no treatment is perfect, even in massage therapy. I believe, for me as a patient, if I combine massage therapy and I have a joint issue, I would go for chiropractic and massage therapy combo so that I can actually relieve the pressure on the joints. At the same time, I'm able to work on the muscles around the joint that I'm having issues with. And again, it does complement with each other. The next one is physiotherapy. I'm going to be honest with you. I don't like physiotherapy. I don't like physiotherapy before, probably because I didn't enjoy the first few sessions I had with my first physiotherapist. And again, I'm not saying that all physiotherapists are bad, but it's the same in every job. You have one person who does the job superb, and you have one person who doesn't really care about the job. Or maybe their treatment style is not my style. That's why I didn't enjoy it. I'm not saying, she did help me in some, but I didn't really enjoy it that much. And again, probably because her treatment style is not my style. But when I met these two lovely physiotherapists that I worked before, and now I'm their patient after we worked from a long time ago, I realized that I do love physiotherapy because at least it gives you the correct and precise exercises to do for issues, especially for posture. So yeah, in my previous episode, I have mentioned that your RMT can give you some exercises that you can do post-massage. But the exercises given to you by your physiotherapists or the kinesiologists or the physical assistants they're working with you is something very specific to your condition and trying to treat the problem as a whole. Again, that's what I think about it. So that's why I like physio now, because after, let's say, my massage or a chiro appointment or anything muscle related, I would love to get an input from my physiotherapist to see which exercises I'm going to be doing very specifically and to get assessed more thoroughly on which exercises should I do more to help me with my posture problem. Not a specific muscle, but a muscle group as a whole. And I think that's important because you're going for adjustments, you're going for muscle massages and stuff like that. However, I think it's still nice to actually get a proper exercise treatment plan based on my job, based on my lifestyle, and based on my preference. Because if you go for something generic, then it also goes like in massage, for example. I used to tell patients that, this massage treatment is not the same with the other ones I've done. It's specifically made for the patient. So the same thing with the physio therapy I got. They actually focus on exercise and manual therapy to target muscle groups as a whole or specific ones to make sure that all muscles are prepared and strengthened with or without actual treatment. So let's say if I'm only seeing my physiotherapist once a week, at least while waiting, I have a very specific and customized treatment plan that I can follow through the exercises they are giving. That's why I love my physiotherapists. There are two of them, Joyce and Jonah, would recommend. What do you call this? And it's because of this, right? They give me something very customized to my lifestyle based on assessment so that I know what I'm supposed to do and I'm not just guessing. Because again, what if the exercise I'm doing is not really the best for my posture? Next is osteopathy. When I had it in the beginning, it was very what's the word? I was very doubtful because it's like a mixture of massage, mixture of chiro, and I don't know, like it in the beginning it was weird until the end of the treatment. My osteopath explained to me that there are some visceral organs inside me that are compensated because the fascia is tight because of my hip flexors, and it's causing other issues other than the muscular ones. And it did make sense by then. From what I understand, correct me if I'm wrong, but for what I understand is osteopathy focus on finding the root cause of the discomfort or dysfunction. So basically, it's not just, oh, you pick on this item, pick the shoulder because that's the problem. They take a look at you as a whole. So not just outside but also inside of your body. Because if you again would go on my very first episode, I have mentioned there a technique called fascial technique. And that technique is focusing on fascial restrictions. Now, this fascia is also connecting organ to organ. So it does make sense that if my fascia is tight, it can affect my organs. And I did the treatment and I did see some improvements. However, the osteopath I've seen had to move somewhere else and I had to move as well. So it didn't work out for the both of us. But I believe, on my opinion, I should still explore more osteopaths because I've only seen one. But I believe combining it with others like chiro, physio is not a bad idea because at least osteopathy also caters the inside of your body, not just the outside. So at least you get the full package, right? So maybe I'll make another episode just exploring about osteopathy, but so far that's what I know about it. So, I mean, to compare the differences of my experiences out of all, one thing that they overlap with is that they always do muscular work. They make sure that muscles are open first, relaxed first before they do their actual work. Like for example, for physios, they try to release the muscle tension first, so that they can give you the proper exercise. The same as for chiro, they need to release the muscle tension first to do the adjustment, and the same thing with osteopathy based on my experience. So I think that's where they overlap. And of course, massage therapy is focused on the muscle itself. What I'm thinking is that massage therapy is a long-term effect on muscles, and the ones that the chiropractor, physio, and osteopathy is something to ensure that they are preparing the areas they're gonna work on, and also giving a long-term effect for the patient. Because example, if they just adjusted the neck, for example, and then there was no muscle work, so it does not make sense that there's no warm-up. So at least if everything is open muscular wise, then they can do their own proper technique and the treatment will work itself. And again, every treatment has a different scope of practice. If you're gonna check the different colleges, it would have their own scope of practice. But for example, for massage, it's the soft tissue mobilization, so the actual massage itself. And from a rough guess, maybe chiropractor is focused on spinal adjustments, physios are focused on providing rehabilitation through exercise, and osteopath is trying to cover the ins and outs of the bodies, like skin deep and organs and stuff like that, right? We have different flagships, like I would say. So at least there is a different target area, but the goal is one: to release the abnormal posture, the problem, through releasing the joint, exercise, trying to get rid of the fascial restrictions of the organs, and trying to release muscle tension using soft tissue manipulation. And that's how I see these two things overlap with each other. And I think it's not really a bad thing. I think it's a good thing that it is like this, because if every treatment is the same, so why are we getting different stuff for one thing? And again, it's true. It's not only massage therapy that can fix your muscle issues, because what if the joint was really the problem? And yeah, massage therapists, we do light grade of joint mobilization, but it's different if it's the chiropractor doing the joint mobilization, right? The same thing that I mentioned earlier as well. It might be different for the self-care exercises. It might be different if I'm giving it to you as an RMT versus as a physiotherapist or a kinesiologist trying to give a proper exercise to you, right? So maybe there's a little bit of difference. And again, my suggestion is to go with someone who you prefer based on your condition. It's like if you need more muscle work, then maybe go for massage therapy. If you need more joint work, then maybe go for chiro, or spinal work, go for chiro. If you need more strengthening, stretching exercises passively, then go for physio. And then if you try to see something inside your body, then go for osteopath. We need to do our research first. This is only based on how and what I experienced when I got all of these services. But these are the 4 things that I figured that are very similar with each other. And I think it's nice if we combine them once in a while. The main points of this episode is, I think the best way to figure out what type of treatment you should do is to determine the goals of your treatment. If you want to do more muscle work, then do more massage and stuff like that, because it makes sense. My suggestion is to try to see which treatment actually makes sense for your problem, rather than going to one treatment and expecting that everything will make sense if we just go to one, right? Like for example, I have a patient who thinks only massage can help her. I mean, yes, massage has a wide array of benefits and risks, especially advantages. However, there are things massage therapists can do that only chiropractors can do, only physiotherapists can do. And I think that's something to think about when you're trying to pick which treatment you are going to go with. Or maybe you're looking for a combination. Maybe you're going to go with massage chiro combination, massage physio combination, chiro physio combination, or so on and so forth, right? I think it really depends on what makes sense in your treatment plan. Another thing is that it also depends on how comfortable are you in doing these treatments. Because I have some patients, they're not really happy about doing chiropractor because they're scared, not because they don't believe that it works, but for them they're just scared of the adjustment. And I know some patients as well, or people, that they don't really want to go to physio because they had one bad experience with another one, or they don't feel that it's working for them. And the same with massage. They don't think massage is going to be helpful for them because it's more relaxation. So it kind of depends. So I think it also depends on where you're comfortable with, if you're comfortable with adjustments, deep tissue, or something like that. I think those are the things you need to consider for which one. And lastly, always ask your therapist. So I'm talking about me being a massage therapist. Here at Thrive, what we do is we try to recommend, even if we don't have the service on our practice, we still kind of recommend. We do have some affiliated practitioners like naturopaths, Ayurvedic practitioners that's coming soon. But it's because massage therapy can't solve the problem. It means it's not in our scope to give no, we can't even diagnose. It's not in our scope to give the treatment for you, and it should be somebody else's scope of practice. So maybe a chiropractor can see you better, right? And we tell you that as an RMT, I mentioned that. So for example, I have a patient and I believe that maybe the tension coming from his body is because it's lack of exercise, and I'm not really a big exercise person, so I would really go for another physiotherapist, so that the physiotherapist can give a better advice rather than me giving not up to par advice, and it's not going to help the patient. At the end of the day, I want to help you. So it makes sense if your RMT is recommending you to see other practitioners to help you with your issue. Because one service or one treatment is not going to be the perfect one for your condition. There would be variety, and that variety depends on what you need. And that's it, right? I think going forward, what I'm going to be doing, and I'm going to do a follow-up episode on this, is that I'm going to try to focus more on the treatments and offer more reviews on how these works and proper combinations of which ones to pick. But for now, that's it. So there you go, Thrive Mates. Thank you for tuning and listening in to Thrive RMT Podcast. Don't forget to subscribe, leave reviews and comments, and share this to your family and friends that's confused at the moment to figure out which treatment should they go for. Don't be confused. Think beyond the box. If you have any questions, suggestions, or clarifications, you can email me down there, and I would be very happy to answer your questions for you. And before you leave, something to think about is, based on your opinion, which one of the following services would you combine with massage and why? Okay? Which one of the following would you think is good? And then leave it down on the comments so we can discuss it on our next episode. And I think that's it. I hope you enjoyed this, and see you next time. Bye.